Today, we're talking about something that's right at the crossroads of incredible medical science and some of the most personal choices a person can ever make. It's called genetic counseling. It's really all about how we navigate really tough information to make empowered decisions for our families and our future. So let's walk through what that actually looks like. To really wrap our heads around why genetic counseling is so vital, let's start with a hypothetical story. Just imagine a family, overjoyed, welcoming a new baby girl into their lives. So the baby is born full term, and at first, everything seems perfectly fine, no complications at all. But then, by 3 months, the parents start to notice things that are concerning. The baby has no head control, and she can't sit up on her own. By the time she's 6 months old, the situation has become just dire. She's now completely dependent on a mechanical ventilator, and every attempt to wean her off of it fails. It's just a terrifyingly rapid decline. Obviously, the doctors are trying to figure out what's happening, so they perform a muscle biopsy. And the results, well, they deliver an absolutely devastating diagnosis: Werdnig-Hoffman's disease. It's a really severe genetic disorder that attacks nerve cells in the spinal cord, and it causes this progressive, relentless muscle weakness. The doctor then has to sit down with the parents and explain the reality of the situation. This disease is incurable, it's chronic, and it means their daughter will never be able to breathe on her own again. The prognosis is just crushingly clear. Most children with this condition don't live past 6 to 24 months. And in that moment, a family's entire world just shatters. So in the midst of this awful, awful news, the doctor's job isn't quite done. Their guidance has to look beyond the immediate tragedy and think about what comes next. And here's the crucial part. Besides talking about the care for their daughter, the doctor strongly recommends that the parents go see a genetic counselor. This advice is a really important shift. It moves the focus from just managing the current crisis to trying to understand what this all means for the family's future. Which, of course, leads us right to the big question here. The doctor recommends it, but what is it? What does genetic counseling actually involve? All right, so let's dive into the core of it. We're going to get some clarity and context here. The key is to think of genetic counseling not as someone giving you orders, but as a source of really powerful information and support. So here's the basic definition. Genetic counseling is a process. It's not just a single test you take. Its whole purpose is to give parents information on the probabilities of genetic defects, and that word is so important. Probabilities, not guarantees. And the way they figure this out is by looking at the parent's own genetic makeup and also by tracing patterns of disease through their family history. But it goes so much deeper than just a risk percentage. It's a whole support system. The counselors don't just give you the odds. They help you understand what those odds could actually mean, the consequences of a defect, what therapies are out there, what kind of care might be needed. They even help you take a realistic look at your own personal, financial, and social resources. It's all about building a support network and connecting you to other professionals who can help you through it. And that brings us to what is, without a doubt, the most fundamental rule of genetic counseling. It's this bright line between giving someone information and giving them instructions. The guiding principle, the absolute bedrock of the whole thing, is that the parents, and only the parents, make the final decision. The entire point of the process is to empower them with knowledge, with context, with support. It's about giving them the tools they need to make the choice that feels right for them, for their family. It's a resource for decision-making, never a directive. Okay, so if the final call rests with the parents, what are the kinds of things they have to weigh? This is where everything shifts from the clinical and the scientific to the deeply, deeply personal. Let's walk through these considerations because they are incredibly complex. It starts with something fundamental. How much do you want and need to have children? Then you have to weigh that against the cold, hard numbers, the actual genetic risks. Then comes a really honest assessment. Do we have the emotional, financial, and physical capacity to care for a child with special needs? They also have to think about the potential suffering of the child themselves. And finally, they have to look ahead and consider the risk of passing these genes on to future generations. These are just impossibly heavy things to try and balance. Which really leaves us with this final thought. Genetic counseling doesn't make the uncertainty go away. It can't. It doesn't get rid of the pain. But what it can do is provide the clearest possible picture of the risks, the realities, and the resources that are available. And by doing that, it helps replace the fear of the unknown with the power of an informed choice. And in these situations where there are absolutely no easy answers, that sense of empowerment, Well, that can make all the difference in the world.